can you tell us about the role your organisation plays currently in Scottish society?
Yeah, I think it's always good to talk a bit about what HIV Scotland does, because as a policy organisation, people often think, well, what is policy? It's a very grey word. So for us, when we work with policy in HIV, it means we're looking at the systems, we're looking at the laws, we're looking at the way that decisions are made. And we think that's a really critical place to be looking, because that affects the rollout of everything else. So we leave all the other direct service providers to it, the ones who are doing community development, who are out there handing out condoms, who are out there helping people who are newly diagnosed. And we look at how are decisions made about where money's spent, how are decisions made about what laws exist, so laws around prosecutions, sex work, injecting drug use, laws around how much we spend on condom provision, what treatments are made available, what's happening with welfare and employment systems.
What kind of policies are you developing currently or involved with that are specific to Scotland and Scottish issues?
Yeah, well, our focus is specifically in Scotland. And of course, I think the challenges of working in HIV is that you have to understand the global context, because it's a global epidemic. So you have to understand how it's working globally and then apply that locally. So for us, we look at what's happening within Scotland, and we talk a lot to people living with HIV and those at risk, because our focus really fundamentally is based on people with HIV should be leading this. So we have quite a few systems in place. For example, our annual Positive Persons Forum. We meet every February, and we have dozens of people with HIV come to that and tell us what are the priority issues for them. So this year they said to us it was employment, welfare, disclosure was the number one issue. And so disclosure included all sorts of things around who you're telling, how you're being treated when you're told, who you have to tell, understanding who you don't have to tell. And they also listed ageing as a growing new issue, and then policing and crime, and understanding your rights within the legal context. So that's what they listed this year. And then each year what we do is we run this forum once again each year, and make sure that we've got the best understanding of what the issues are coming from the voice of people living with HIV. And then we have a series of other ways that we keep talking to people to say to them, is this right for you? Are we heading in the right direction? And then the next level to that is not just to get people to lead it and to tell us what they want to see happening, but it's to actually get them speaking directly to decision makers. Because there's nothing more powerful than someone going to Parliament, someone meeting with an MSP or with any public service leader and saying to them, I've got HIV and this is what's important for me. We know that changes people's minds, that influences people more than anything else, more than any report we'll ever write. If we've got people's actual lived stories leading that work, that's where changes come from.
What are your hopes then for changes in policy in the immediate future?
Well, so again, I always come back to probably the most powerful driver for us is the manifesto that comes from the Positive Persons Forum that we run every February. And so I listed the issues like we talked about ageing, disclosure, welfare, employment. There's a couple of others. Forgive me for not having them all at hand. So my hope is it's a complicated system. There's lots of different subject matter, and for some people with HIV, ageing is critically important, and we know that's an emerging issue. For others, it doesn't matter at all to them. So my hope is that we can keep working on a very complicated system where there's lots of different factors and lots of different needs and lots of different stakeholders, that we can keep on top of all of those things and that we can agree on priorities and invest wisely in that. Now, how do we do that? Probably for me, the simplest thing at hand is we've got a national framework for sexual health and bloodborne viruses, and we call that the framework, and that brings together HIV, viral hepatitis, so Hep B and Hep C, and general sexual health into one. They don't call it a strategic document, but it essentially is. The framework gives us our strategies. So my hope is that our framework very clearly sets out who our key populations are, that explicitly names gay men, other men who have sex with men, it explicitly names sex workers, explicitly names people who inject drugs, transgender communities, and people in prisons. You know, these are the 5 key populations, and I think World Health have done a great job in their consolidated guidelines by explaining why these people are key populations. So my hope is that the framework really clearly articulates that we need to do interventions specifically for their benefit, but also talks about how we'll do that so that we have community-based, peer-led interventions. That these are not just things that are kept in a system or in a health board, but are based within the community. And again, the WHO consolidated guidelines are very clear at saying you need to have these led by community. Community have to be a part of this.
George, you mentioned the World Health Organization guidelines. They've been quite controversial recently because of the perspective on PrEP. Can you tell us a bit more about that and what your organisation's response is?
Sure. So the consolidated guidelines were published, I can't remember when exactly, it would have been within the last 6 months or so, and it has received a lot of press. And one of the things that we've seen people interpret from them is that people have thought it says all gay men should be taking PrEP. And specifically what the guidelines say, now again, I'm not the spokesperson for the guidelines, but what I did like from the guidelines is it said all gay men should have access to PrEP if they want to take it. And it's essentially saying that PrEP is now recognised as what could be a very effective HIV prevention. So what PrEP is, it's essentially anti-HIV drugs. So the same treatments that someone with HIV is on, they're kind of similar to that. And what they do is they stop the HIV virus being able to take control of your body and being able to spread through your body. And therefore, taking PrEP has got very good evidence to show that if you take it, you're unlikely to acquire HIV. So it's a very good medical prevention. So traditionally we've used condoms, and they are quite effective. They've got some limitations because of people forgetting to use them or getting too drunk and not remembering to use one, or just not liking them or being tired of them or whatever. We've had lots of discussions in the years.
I can imagine. Yes.
So PrEP's sort of another layer of prevention. What we're recognising is you need multiple different types of prevention. Condoms is absolutely one of the very important ones, and PrEP should be added to that.
Thanks for clarifying that. You make some very pertinent points there. You'd be aware of the partnership study?
Yeah.
I think to say about that.
I think it's good to link to the partnership study, because the partnership study, for those who haven't heard of it, it's a study that's recruited hundreds of heterosexual and homosexual couples, and they've looked at these are couples where one person has HIV and one person doesn't have HIV, and they've been recruited, and all the right ethics have been used. And they're looking to see whether HIV is transmitting between these couples when one of the couple is on treatment. What they're looking to see is when the person who's got HIV is on treatment, will there be any transmission since the person's on treatment? So will treatment stop them from spreading the HIV? And so this study's been in, I think they're in the 3rd year of a 5-year study. It's something like that. Forgive me if I'm not right on it. Yeah, well, don't take my word for it. It's something like that. Something like that. And so far, there's been not one transmission in that study. And so what they're using that as evidence to show is that treatment, they're calling this treatment as prevention. So if you've got HIV and you're on treatment, your chances of passing on the virus are incredibly low. So far, it's 0 in the partner study. And what this evidence is telling us very clearly is that if you've got HIV and you're on treatment, it will keep your viral load so low that you won't pass it on. And that the rate of transmission, so if you've taken that, the rate of actual failure where you do transmit is lower than if you use a condom. So we're saying that treatments are more effective than condom use in that setting, right? Condoms should also still be used, but because, if you don't know the person, if you've never met them, you have no idea if they're on treatment, you have no idea about their context, and they have no idea about yours. So in that case, condoms are the best tool to use. Now that we can show clearly that treatment is prevention, we can say if you've been on treatment and you had sex with somebody and you didn't tell them you had HIV, because you don't legally have to do that in Scotland, you didn't tell them, so they didn't know you had it, and you didn't use a condom, or you did, or no, let's say you didn't, that would be the case, that you didn't use a condom, but you were on treatment. Now, on a public level, you might feel quite put out by that. You'd think, how dare they not tell me? We had unprotected sex and they had HIV and didn't tell me. But on a law level, if it's not passed on, they're on treatment, which means that their chances of passing on infections are very low. That becomes useful evidence to say this person was taking precautions. Now, I know that I guess I've got to be cautious in how I say that, because I don't necessarily want to be advocating to say that that's okay to do.
I was going to ask you that, clearly you're not.
Yeah, no, because the thing to remember about these is that these happen in particular contexts. So this is not something that's happening out there generally. This is kind of, this might be a story where a couple have been together for a long time, and maybe one person's been has not revealed their status to the other person, and there's a whole bunch of ethical issues around there which are different to the legal issues. And I guess you've got to ultimately think about, do you want to send this person to prison because they had sex with this person, they didn't give them HIV, they did not give the person HIV, but they maybe expose them, and therefore you want to put them in prison. So what is that going to change? And I guess that's the conversations we've been having with the Crown Office about saying that we need to understand the full range of prevention tools, that being on treatment, that using condoms are actually both prevention tools.
Part of the problem that people with HIV continue to experience is the stigma attached to that. And what is HIV Scotland doing to tackle stigma and also to change public perceptions about HIV?
Yeah. So reducing stigma is an underlying principle to literally every single thing we do. So what we want to specifically see happen is a much clearer articulation of what stigma is and a better understanding of how we measure that we've reduced it. Like, how do you know? Because it's so amorphous. So how can you actually say that you've reduced it? And so we're looking at particular tools in measurement, particular evaluation tools that you can use to say that you've reduced stigma. And just to say a little bit more on stigma, so there's one thing is to understand discrimination, which is it's a decision where people break the law, where you cannot lawfully stop someone from HIV having most jobs. So if you don't employ someone with HIV in a particular job, there's very few that you can't legally do if you have HIV. So if you stop someone because they've got HIV, that's discrimination. Now discrimination, that's breaking of the law. And that happens because stigma affects that, but actually the act of treating someone different because they have HIV is discrimination. And the reason people have discriminated is because stigma makes them think unrealistic thoughts about HIV. So one piece of work is to understand discrimination and to therefore educate people who are discriminating to help them to not do that anymore, to empower people with HIV to understand what their rights are under the law. And then the other piece of work is thinking about stigma in the context of, when in the Positive Persons Forum that we run every February, people say to us a lot that stigma comes from lovers, friends, family. That's where they mostly feel that from, because that's who you're going to tell you've got HIV to. You're not going to walk around the streets telling everyone. No one does that.
A lot of people, that becomes a revelation though.
What does?
The fact that most stigma would come from family.
Yeah, but I think if you think about with any chronic illness, so let's look at HIV, who do you tell you've got a chronic illness to? You tell your lover, you tell your mum, you tell your best pal, then you'll tell your doctor, and then probably the nurse will know, the admin might know there. So we hear that stigma is happening from sort of a lot of the service level stuff around some health services, depends on where you're living in Scotland, depends on how many people with HIV there are, and from friends and family. And then of course in your job as well. A lot of people that we speak to say that they don't tell their employer, and those that do have given us lots of stories of both discrimination and stigma. But it's probably worth noting, because I don't know who's watching this, but I guess it's important to know a lot of people have really good experiences. And so we're really happy with those, and we wanted to promote those. But also, it's important for us to address where things are going really poorly. So I've talked a little bit about, so discrimination is the legal issue, and then stigma is sort of the social issue of how do people with HIV feel about their own status? How are you thinking about yourself, and how are you being okay with having HIV? And then how is that influencing your relationships? So there's those different levels, and we think the framework's a very good tool to be clearer about that, around what are we measuring, what specifically do we want to prioritise, and then how do we know that we've reduced it. So it's nice to say we want to reduce it, but how can we then evidence that we actually have done that? How can we say society in fact has changed? And so we'll be using the framework as sort of the vehicle for doing that.